Hi there.
Hello.
My name's Alyssa. I'm going to be a student nurse. And can you give me your name and date of birth?
Alexis Nogi, 11898.
And do you have any allergies?
Nope.
Alright, I'm going to provide privacy. I'm going to do hand hygiene. And then I'm going to make sure that my patient's name band matches my chart. I'm going to verify orders to do a head-to-toe assessment and that she really doesn't have any allergies and that I do have the correct patient. So, like I said, I'm going to be doing a head-to-toe assessment on you today to just kind of see what brought you in and what's going on, okay? So, what brought you in today? What's your current complaint?
My wrist hurts.
Your wrist hurts? Okay, so I'm going to conduct a pain assessment then. So, does anything make that better or make it worse?
Just when I ice it feels better.
Okay, and then can you just describe this pain to me? If it's dull, sharp, stabbing, shooting?
It's a sharp pain.
Okay, and then does this like move anywhere, radiate up or down to your fingers, or?
It radiates up my arm.
Okay, and then on a scale of 1 to 10, can you rate this pain for me?
I would say a 10.
Okay, and then when did this start?
2 days ago at practice.
Okay, and then does this affect any activities of your daily life?
Mostly just when I sleep, it keeps me up.
Okay. Are you on any current medications today?
Mm-mm.
No. Do you smoke or vape or drink any alcohol?
Nope.
Use any other illicit drugs?
Mm-mm.
No. Okay. Do you have any past medical history that is pertinent to what brought you in today?
No.
No. Any past surgical history I should know about?
No.
Okay, so at this point I would now do vital signs, but since we're doing it in the lab, I'm not actually going to do it. But I would do blood pressure on her right arm since her left arm is hurting her today. I would assess heart rate, respirations, and temperature. And now I'm just going to ask you to walk over to that chair and then walk back so I can assess your gait and your coordination. Okay, and then you can just walk back and sit back down for me. So my patient's gait is well coordinated. She's not stooping or dragging her feet or limping or anything like that. Her posture is erect and she seems to be in a good posture. Her behavior and her attitude is adequate for the situation, and her speech has been clear. She is well nourished and she is just appropriate for the situation today. So next I'm going to assess my patient's skin color and just her skin integrity and things like that. So I'm going to be integrating this throughout my whole head-to-toe assessment, but for right now I'm just going to do a quick overview. So at a quick glance, my patient looks to be the correct color for ethnicity with pink undertones. She's not cyanotic, and her skin is dry and warm to the touch. Her texture is smooth, and her skin turgor seems to be correct and appropriate for her age, and she doesn't seem to be dehydrated. I don't see any signs of edema or ecchymosis or any abrasions as of right now, but I will keep looking throughout my head-to-toe assessment. So now I'm going to move on to your head and your neck and your face, and just by inspecting my patient, her facial expressions have been appropriate, as well as her mood for the situation and for being here today. Her face is very symmetrical, and now I'm just going to ask you a few questions to understand your orientation and your levels of consciousness, okay? Can you say your name for me?
Alexis Nogi.
Okay, and where are you?
Toledo Hospital.
What date is it?
January 26th.
Okay, and why are you here?
My wrist.
Okay, so my patient is alert and oriented ×4, so she's alert and oriented to person, time, place, and situation. So now I'm just going to inspect your external eye structure, so if you can just look at me. So I'm just inspecting my patient's eyelids, eyelashes, lacrimal ducts, things of that sort, just to make sure that everything's symmetrical, and she does seem to have clean lashes, her eyelids are intact, and her lacrimal ducts seem to be functioning properly. Next, I'm going to assess perla, so if you could just look ahead for me, I'm just going to be assessing your pupils. Your pupils are equal, and they're about 5 millimeters in size, and now if you can just look ahead for me, I'm going to shine this light to see if your pupils react. Alright, and now next I'm going to ask you to look straight ahead, and I'll focus in on my finger. Okay, pupils do react to light and do accommodate, so pupils are equal, round, reactive to light, and accommodation. And now I'm going to pull out this Snellen chart out of my pocket to assess your vision. So if you can hold this straight out in front of you and repeat the smallest line that you can see.
LDCZOTE.
Okay, and that is 20/20 vision, and you're not wearing contacts and you don't wear glasses, correct?
No.
Okay, So vision is adequate. And now I'm going to hold up my finger, and without moving your head, just your eyes follow my finger, please, to test the 6 cardinal positions of gaze. Alright, so our extraocular movements are adequate and intact. And now I'm going to assess your hearing. So if you can scooch to the edge and then turn your head that way, I'm going to whisper a word to each ear, and then I'm just going to ask you to repeat what I'm saying, okay? So I'm going to start with your right ear.
Pineapple.
Okay, and then?
Apple.
Okay, good. And you can scooch back and sit. So my patient did repeat the words that I whispered into her ear, so her hearing is intact. And next I'm going to move on to your mouth. So if you can just open up your mouth and say ah for me. Alright, my patient's mucosa and inside of the mouth is intact, pink and moist. Her uvula is midline. Can you stick out your tongue for me? Her tongue is also midline, so her cranial nerves are intact. Now I'm going to move to your neck. So I'm just going to palpate and just kind of look at you for a second to see if any of your lymph nodes are inflamed. And I don't feel any lymph nodes that are enlarged, and her neck does seem to be intact. And again, her skin is correct for ethnicity. Her with pink undertone, she's not cyanotic, there's no abrasions, edema, anything like that, and she is warm and dry to the touch. So next I'm going to move on to your upper extremities. So if you can just hold out your arms for me, her arms are symmetrical. Again, her skin is dry, warm, intact, skin color is correct for ethnicity, and her skin turgor is appropriate for her age and hydration. So I'm going to ask you just to push against my arms, so lift up, and then pull down, and I'm going to ask you to squeeze my fingers with your hands. Alright, so you can lower your arms. Strength in both arms is equal, bilateral, and strong. And now I'm just going to assess your pulse, so you can just rest your arms. Alright, her radial pulse in both arms is a +2 and equal bilaterally. And now if you can just flip over your hands for me, I'm going to assess capillary refill in each finger. Capillary refill is less than 3 seconds on both hands. And like I said, her arms are symmetrical and skin is intact. And now I'm going to ask you to flip around, but don't lean all the way back, because I'm going to listen to your back here and kind of assess your posterior thorax. So now I'm going to look at the shape of her posterior thorax, and her AP to T ratio is 1:2. And she doesn't seem to be in a tripod position or having any difficulty breathing. So now I'm just going to listen. So I'm going to have you take some deep breaths for me every time that I move my stethoscope, okay?
Okay.
Alright, go ahead. And now I'm going to listen once on each side. Okay, there were no adventitious lung sounds that I heard. Everything sounded clear, and her skin is intact on her back, and skin color is still constant throughout. She's warm, dry, and no signs of cyanosis, or there's no crepitus around the lung area, and everything seems to be intact. You can lay back now, and I'm going to do basically the exact same thing, but to your chest, okay? I'm going to give you a couple minutes to kind of not be out of breath. And so her anterior thorax, she doesn't have a barrel chest from anything as of COPD or anything like that. She doesn't have the concave chest either. And like I said earlier, she's not in a tripod position. She isn't having any difficulty breathing. After this, I'm also going to listen to your heart sounds, but you can breathe normally after that. But I'm going to start again by having you take some deep breaths for me. no adventitious lung sounds from the anterior aspect either. And now I'm just going to listen to your heart sounds, and you can just breathe normally for this. So I'm going to start at the right sternal border at the second intercostal space, and that's your aortic valve. And S2 is louder than S1 here. And I'm going to go to the left sternal border at the second intercostal space, and this is your pulmonic valve, and again S2 is louder than S1. Now at the third intercostal space is your Erb's point, where S1 and S2 are the same loudness. And then the fourth intercostal space is your tricuspid valve, and S1 is louder than S2 there. I'm going to go under here, and this is your fifth intercostal space, and this is your mitral valve. Again, S1 is louder than S2. And then at this point, I would listen at the mitral valve and count for a full minute while holding on to my patient's radial artery to assess for the apical pulse. Next, I'm going to move on to your abdomen, so if you want to lay down. And also when I was assessing the apical pulse, I would assess for, like I said, a minute, and then I would comment on rate and rhythm at the same time if it was regular. Alright, so now I'm just going to assess the contour of your abdomen. And my patient's abdomen seems to be flat. Her skin is intact, is dry, is warm. There's no abrasions or edema that can be noted, and her skin color is correct for ethnicity. Her umbilicus is midline, and there's no hernias or bulges or anything like that. Are you having any abdominal pain today?
No.
Okay, so now I'm just gonna listen to your bowel sounds. Alright, bowel sounds are active in all four quadrants. And now I'm going to palpate your abdomen, so I'm just going to give you some light touches on your abdomen. Alright, and there's no masses or bulges or anything that I felt. You can sit back up if you would prefer. And now I'm going to assess your lower extremities. So again, her skin's intact, her skin color is appropriate for ethnicity with pink undertones. I don't see any edema, but I'm going to check all up and down my patient's legs for this. No edema is palpated. I'm going to check your pedal pulses. Okay, I would say it's about a +1 and equal bilateral, and now I'm going to move down to the foot of my patient's bed to check for capillary refill on the bottoms of her toes. I checked on each toe, and her capillary refill had a reaction time of less than 3 seconds, so her perfusion is intact. And now I'm going to ask you to push up against this leg, or this hand with your leg, push up, and I'll do the other one. Alright, and then pull up against my hands and push down like you're pushing on the gas. Alright, my patient has adequate strength in both legs. It's strong, adequate for age and for status and stature. And then after this, I would do hand hygiene. I would lower my patient's bed, because if we were in a hospital, I would have raised my patient's bed so I wasn't leaning over the entire time. I would thank them for their time. I would make sure my patient has her call light and her side rail would be up for safety. Then I asked if they needed anything before I left, and then I would document all of my findings. And yeah, thank you for your time.
Thank you.